What's up, guys? I'm Ben. I'm a PA, and I've been working in the emergency room for the last 10 years or so. And I'm going to be doing some medical review videos on various topics and for various audiences. But this one is as if you're like doing an emergency medicine rotation or you're a new provider in emergency medicine. And I'm going to talk about what to order for a patient with abdominal pain. Kind of what's the most basic stuff, and then going just a little bit beyond that as well. All right, so we'll talk about what to order and why for a patient in the emergency room with abdominal pain. So first, let's start with the basic labs. So the way I kind of remember this, I don't know if it makes any sense, is I kind of just go in a circle in my head, like around the abdomen. And when I go across the top of the abdomen, for some reason I say to myself, CBC, CMP, lipase. Those are all relevant to the top of the abdomen, but the CBC is relevant to the whole abdomen. But it's just like really basic to get a CBC, right? So CBC, CMP, lipase. So why is CBC? Well, it's both really foundational and kind of helpful for certain conditions, like infections and stuff, or appendicitis or whatever, if like you have a high white count, or you want to know if they're anemic or whatever. But it's also like not really that high yield in general, because even the high white count doesn't tell you exactly what's going on, and you have a lot of pretty normal CBCs with people with abdominal pain. So you get it, but it doesn't always tell you much. Why do you get a CMP? Why do you not get a BMP? So you get a complete metabolic panel, not a basic metabolic panel. That's a common mistake that nurses will make if they're like protocoling my patients. They'll sometimes just order a basic metabolic panel on somebody that has abdominal pain. It's like, no, get the CMP. Always the CMP. Pretty much always, unless you're ordering some other labs to kind of compensate. So why the CMP? Well, that's because in addition to the basic stuff like the electrolyte levels and the blood sugar and the kidney function, which you have on your basic metabolic panel, in addition to that, you get a few other things like the liver function tests and the ALK-Phos and the bilirubin. So those are relevant to the gallbladder and the liver. So of course, if you have abdominal pain, right upper quadrant, gallbladder, liver, so that's where the CMP comes in. So that's why I'm thinking like starting on the right, going to the left, CMP, lipase. Lipase because that's relevant to the pancreas. So high lipase could mean pancreatitis. All right, so that's the upper abdomen, and that's not exactly true, but that's kind of how I think of it. And then going to the lower abdomen, if it's a female who could be pregnant, then get a pregnancy test. So you always do that. You don't ever think twice. If they have a uterus and they're in an age range that could get pregnant, then you should get a pregnancy test. And then a urinalysis is the other one. So the bladder's down there and the uterus is down there in the lower abdomen. And of course, like I said, the CBC is relevant to both the upper and lower, so that wasn't perfect. So those are your basic labs. So again, the order I always kind of think of it in is CBC, CMP, lipase, pregnancy, UA. And the pregnancy you leave out if it's someone that could not be pregnant, a man or a woman well over menopause age or other such examples. All right, so are there any other labs that you would want to get on somebody with abdominal pain? Well, the answer is on average, no, but in a lot of specific cases, yes. So it just depends on like the situation. So let's say it's an old person with epigastric pain. Pain just right below their chest could mean they have a chest problem, especially in an elderly person. So if that's the case, you'd want to get a troponin at least, and probably an EKG, for example. Another example would be, what if you're worried about sepsis because they have like a fever and tachycardia, then you get a lactate. And the lactate's also kind of useful for bowel ischemia. Or another example might be, you could get coags, like your INR, PT, PTT, if they're on a blood thinner or if you think there might be some bleeding problem or whatever. Or coags are also relevant to liver failure. So those are all kind of extra things that you might think about, but the initial 5 labs that I told you at the beginning is your basic labs that you'd order on pretty much anybody with abdominal pain. All right, so let's talk about imaging, meaning, x-rays, CAT scans, ultrasounds, that sort of thing. So basically, in this modern age, x-rays are pretty rare. You don't get a lot of x-rays on abdominal stuff in the ER. Maybe in kids, you know, sometimes, but in adults at least, it's very rare nowadays. But we pretty much will do either nothing, which is normal and fine. You don't always need to get imaging on people if you don't think it's going to be a surgical issue or there's not something really to look for. But usually if you get imaging, it's either an ultrasound or a CAT scan or both. And so let's just kind of work our way around the abdomen real quick and talk about ultrasounds and CAT scans and what type to order or whatever. So right upper quadrant, you got your gallbladder. So the main thing you're going to look at in the upper abdomen with an ultrasound is the gallbladder. They look at other things too. They look at the liver, they look at the kidney, the right kidney mainly. They can look at both kidneys if you want. They look at the pancreas, but it's mainly for the gallbladder. So you might get a little information about other stuff, but it's mainly for gallbladder if you have something like gallstones or cholecystitis, something like that. Ultrasound also in the lower abdomen for someone who's pregnant with abdominal pain. So you always get an ultrasound if they're pregnant or vaginal bleeding with abdominal pain. Ultrasound, like I said, for the kidneys. So usually the more sensitive or the better test for kidney stones is a CAT scan, but you don't want to necessarily get a CAT scan every time someone comes into the ER with a possible kidney stone. So from time to time, I'll just get an ultrasound, at least initially, see what it shows and go from there. Because it can show if there's hydronephrosis, it might catch a stone, you know, that sort of thing. So those are ultrasounds, so they're useful for some things. Also appendicitis in kids, you can try to get an ultrasound. Also pyloric stenosis in kids. So if you want to get into pediatrics, there's maybe a little bit more that I might be skipping over. But ultrasounds are useful for a lot of things. But CAT scans kind of are more broad coverage, more clear imaging for most things, but not everything. And what's one of the main things you would want to get a CAT scan for in the ER is if somebody has right lower quadrant pain or tenderness, and you're worried about appendicitis. So one of the main things is appendicitis. Other things are like diverticulitis, bowel perforation, bowel obstruction, bowel ischemia. And there are certain types of CAT scans you'd want to get for those. And it can catch other things, of course, where those are just some of the main ones. Or if they have like a more rare, less common diagnosis, like a new onset of cancer or something like that, where you find a tumor in their abdomen. A CAT scan is going to be way better for that than an ultrasound in most cases. All right, so what about if somebody gets a CAT scan, do they need contrast? So we hardly ever do rectal contrast anymore in the ER. PO contrast we rarely do, but it's mainly if they have like a history of like a stomach surgery, like a gastric bypass, gastric sleeve, something like that, and you want to actually get a good look at that. That's where it matters the most. For most other things, you don't need it, but it can help with like bowel obstruction. And what about IV contrast? Yeah, we do it a lot. It just is a little bit better visualization. Who doesn't need any contrast? Someone who has a lot of body fat. Body fat kind of acts as contrast in the body. So that's pretty much the story on contrast. And then the other big thing that they always talk about is if for kidney stones, it's better to get it without contrast. So if you're mainly looking for kidney stones, you get it without contrast, the CT scan. So you can see if there's a small stone, like the contrast could obscure it because the contrast could cover up the stone, so to speak, on the imaging. All right, so that is kind of a quick rundown. Well, sort of quick, what am I at, 8.5 minutes? Sort of quick rundown of what to order on a patient with abdominal pain in the emergency room. So if you're a new provider or you're doing a rotation or something, hopefully this is helpful. I didn't provide much in the way of visuals because I'm trying to start really simple so I could get started quicker. But if you think visuals would be helpful in some way, let me know. I could think about that in the future. All right, thanks for watching. I'll catch you next time.